This week on the Backtable Podcast.
And it turns out that computers are actually better than humans at pattern recognition. So, for example, this is particularly useful in high-tech specialties, or, for example, the subspecialty of radiology, since accurate image interpretation is really all about pattern recognition. Now, having said that, computers can't do it all on their own. AI is extremely useful, but so are humans. I mean, computers are better at pattern recognition, but humans are better at global reasoning. And so both of them really need to work together. And when we do work together, we can really do extraordinary things, in my opinion.
Hello, everyone, and welcome back to the Backtable Innovation Podcast. You can find all of our previous episodes on our podcast on iTunes, Spotify, and on backtable.com. This is our next installment in the Backtable Innovation Show, where you hear stories from the founders and physician entrepreneurs who are helping to drive healthcare forward through medtech innovation. I'm Eric Gantwerker, your guest host for this week. I'm a pediatric otolaryngologist with a special interest in educational technology and game-based learning. And I have a very special guest today, Dr. Suzie Bash.
Thank you so much for having me.
Awesome. So one of the things I always like to start with is, how would you introduce yourself to somebody who doesn't know who you are and doesn't know what you do?
Okay, that's interesting because I guess we're sort of more defined by just our profession, but I guess I would start with the fact that I am a neuroradiologist, and I also have a lot of interests outside of medicine too. I love traveling, painting, martial arts, playing electric guitar. I am a licensed radio DJ, so I spent a lot of time DJing both in undergrad and in medical school. But I would say my primary passion is artificial intelligence, and in particular, artificial intelligence applications in advanced neuroimaging, really for the benefit of patients and doctors and imaging facilities. I'm passionate about new ideas, new tech, new innovations, and how it can really make an impact in this world.
So tell me, how were you when you were younger? Were you always interested in technology? Were you always interested in innovation? Sort of what was early life like for you?
Well, I think I've always had an interest in technology. I think some people go through life and they are sort of averse to change. I think I've always been one of those people that welcomes change, and in innovation, I think that's what makes life interesting. But there's a lot more opportunities now than when I first began. So just to kind of give you a little bit of background, I did my undergrad at University of Illinois. I went to medical school at U of I as well. I had also studied abroad for a year at University College of London. And then I did my radiology residency I did my internship in San Francisco and my 4-year radiology residency at UCLA. And then I did a 2-year neuroradiology fellowship there. And after that, I joined the neuroradiology faculty. And so at the time when I was on the faculty at UCLA, my primary interest, I spent a lot of time in the 3D lab and publication in comparing CT angiography versus MR angiography and digital subtraction angiography. And then I also did a lot with fetal MRI. But then about 17 years ago, I joined RadNet, which is kind of the largest outpatient imaging enterprise in the United States. And that's really when my interest in artificial intelligence began to develop, because truthfully, AI, now we hear all the time about AI, but back then there really wasn't much. And so RadNet was a really early adopter. So I started using AI in my clinical practice about 15 years ago, which was quite early, and really in the quantitative volumetric imaging space. And I got to a point where I was really using it every day. My referrers were finding great value in this. And then I would say about 4 years ago, the whole AI industry just completely exploded. And so for me, that was huge, because that's something that I really am passionate about. So I started following and tracking the different companies and learning as much as possible, doing different educational webinars and talks, and really trying to stay up with the game. And it's a hard game to stay up with because there's new companies forming all the time.
So for our listeners who aren't familiar with artificial intelligence, how do you describe it?
Yeah, so artificial intelligence, or AI, is a means of using computers to enhance human thinking. And AI not only allows thought augmentation, but it can also improve productivity or accuracy, quality, and even safety. And one of the fantastic things about AI is that some of these deep learning AI algorithms can actually learn from their own mistakes and keep improving over time. So we can use AI to answer questions that will enhance our human capabilities. And, although this is helpful in all areas, I personally, as a neuroradiologist, am interested in AI's, great potential in improving medical imaging and patient care. So in my opinion, AI is really poised to revolutionize not just medicine, but all occupational sectors throughout the world. And we're seeing examples of that every single day. So really all areas of our lives which are impacted by technology will soon be transformed by AI.
Absolutely. And when you came to this space with RadNet and you started with them 17 years ago, did you know about AI? Did you have any interest in it before? How did you actually skill yourself up to be able to take that on?
Well, I was introduced to a product that I was told would be helpful in patients with dementia and seizures. And then eventually we started using it for multiple sclerosis and brain trauma. And now it's moving into neuro-oncology. But I would say at the beginning, we mainly used it for dementia and also some for seizures. And I was very interested in it. And I started exploring more into the product and introducing it to my referrers. So as a neuroradiologist, my primary referrers are neurologists and neurosurgeons and pain management doctors and orthopedists. But neurologists in particular seem to be very interested in this software. I knew it was an AI software. I knew it was machine learning based. Deep learning came in later on, many years later. But back then, again, the AI term wasn't really being thrown around that much. But, it started getting to the point where I was using it every day. And I found in my personal experience that any of my referrers that I introduced this technology to didn't go back. So once they started using it for a certain clinical indication, they would order it every single time for that clinical indication. And again, it's wonderful for follow-up imaging. And so that's kind of how I got introduced.
Yeah. And so when you learned about RadNet and they came to you, were you looking for a position involving AI or how did that happen? How did you meet with RadNet and get this position?
Yes. Well, actually, RadNet kind of was recruiting me at the beginning. So I was getting a lot of calls and I finally, met with the CEO. And what I really liked about it was that he basically gave me freedom to do anything I wanted to do in the neuroradiology space. A lot of times when you go into private practice in radiology, you have to read a bunch of different subspecialties. And I was really only interested in the brain and the spine. And so being able to do 100% neuroradiology was very appealing to me. But I also really liked the idea that they were a forward-thinking company. In a way, you could almost call RadNet an AI company because at this point, they've incorporated, either bought so many AI companies or collaborated with so many AI companies that AI is ingrained in what we do, not just for me in neuroradiology, but all across the imaging spectrum. So we use AI before image acquisition, during image acquisition, and after image acquisition. And a lot of these, again, have only been in the last 4 or 5 years, but it has been a tremendous explosion and it's been extremely helpful for productivity and increasing our quality of our exams and frankly, to increase the positive experience for patients. And we can talk about in more detail if you want about what kind of AI tools that we use, but it's been a tremendous difference and really beneficial to every party involved.
I definitely want to delve deeper into AI because I'm very, very interested in it. I'm actually reading Deep Medicine right now, actually. One question I had, so was there a specific skill set that RadNet was looking for? Or were you in a specific position that they had found you? Or were you, what kind of presence did you have that they were heavily recruiting you?
Well, I think that RadNet was shifting the way that they were thinking in the sense that they really wanted to have academically trained subspecialty radiologists in every field. I mean, the truth is you don't really want me reading your foot MRI. I haven't read a foot MRI since my residency many, many, many years ago. I think that particularly in our specialty, but in all specialties, if that's what you do, if that's what your fellowship trained in, and that's really all you do, you're going to get the best interpretation. And that's ultimately really better for patients. And RadNet was really focused on having the highest quality interpretations of exams to enhance patient care. Their focus has really always been on the patient. And I think that's what their big driver was, to try to get more academic radiologist subspecialists involved.
Oh, that's awesome. Yeah. You wouldn't trust me doing a cochlear implant. I haven't done one of those since I was a resident either. So I totally hear you on that. You talk sort of explosion of AI. Why do you think that happened?
Well, I think that a big component is really the currency of computers, which is data. So there's so much more data than there used to be. And, computers achieve AI by a means of running data through computer-generated neural networks. And computers are now sophisticated enough to, quickly analyze large volumes of high-dimensional data and recognize patterns. And it turns out that computers are actually better than humans at pattern recognition. So, for example, this is particularly useful in high-tech specialties, or, for example, the subspecialty of radiology, since accurate image interpretation is really all about pattern recognition. Now, having said that, computers can't do it all on their own. AI is extremely useful, but so are humans. I mean, computers are better at pattern recognition, but humans are better at global reasoning. And so both of them really need to work together. And when we do work together, we can really do extraordinary things, in my opinion.
And as you have been in this space now, have you seen areas where AI has really not lived up to its promise?
Absolutely. So there are now hundreds of different AI companies that impact the medical imaging spectrum, and there's tons of other AI companies in other occupational sectors as well. But that's why I serve on the medical advisory boards for several different wonderful AI companies. But I also do a lot of clinical validation trials, because it's a very different process as a vendor than it is as an end user. And so what may sound very appealing to a vendor may not be practical in implementation in clinical practice. And that's why I encourage really all AI vendors to get whatever area that they're focused in. So if their product is based in neuroimaging, to get neuroradiologists on their medical advisory panels so that we can give them direct feedback of what actually works and what actually doesn't work. I'll give you an example. So in the quantitative imaging space, where you're measuring the volumes of different substructures of the brain, that can be very, very useful for a lot of clinical indications. But, radiologists tend to, most of them work on an RVU basis. So the more you read, the more you get paid. And so to ask a radiologist to do something that's going to take a lot of extra time out of their day just to process one case is not going to be that appealing to radiologists. So there may be a great AI product that allows the end user to correct segmentation, to make segmentation 100% perfect. But if you do that, that takes it out of the PAC space and puts it into another piece of hard software, an extra computer that you have to have. Well, at RadNet, where we have 700 radiologists across all different states and all different locations, RadNet wouldn't be that keen to install new hardware for all the different radiologists when we already have 4 monitors and everything else. And not only that, but the radiologist isn't going to be motivated to log off the PACS and then log into a different system and then try to transfer it back to the PACS. So it's a great idea, but it's not great for implementation. So those kind of companies don't have as much success as companies that there's a very easy transition into the workflow that doesn't cost the radiologist time, or in fact saves the radiologist time, but still adds value.
Absolutely. I think with any technology, we're seeing ways that the promise has been overhyped and we're going to that trough of disillusionment as the hype cycle dictates.
That's correct. Yes.
You brought up a really good point that we're going to talk about a little bit later, which is radiology in the workflow of radiologists and how that's all going to work out in the future. But we'll talk about that in a second. I want to dive in a little bit more into how you educated yourself in the artificial intelligence space. I know when I started working for a game development company, I read a lot of books about game development because I had no idea how to speak the same language as them. So how has that experience been for you working for a company that's using AI to be able to even speak the same language?
Yeah, so I really think that the part of the learning process is attending meetings and listening to my colleagues around the world speak into this space. And again, AI products are different depending on what kind of practice you have. So some AI products are much more suited for private practice and some are more suited for hospital-based practices. So I'm constantly scanning the literature. I read different articles, I attend different things, and also in preparation for different educational webinars I'm doing or talks I'm giving, things like that. I'm always trying to stay abreast with what is out there. But in particular, I'm interested in things that will be helpful to our practice and our patient population. And if I find something that I think is very promising, that's generally when I work with like my chief technology officer and others and the companies themselves to do clinical validation, multi-center, multi-reader blinded clinical validation trials to see if what they're proposing is actually going to be useful in a sort of a blinded manner in the real world. And I find that if we can prove that it's useful in these blinded clinical trials, then I'm much more keen to promote adopting something like that in private practice.
Absolutely. I think the applications and the use cases are abound. I think validation is going to be such an important step in any of these because we've talked about all of the ethical, moral concerns about AI. We've talked about all of the different biases within the AI data. Have you had some experiences where bias has been introduced or there's been moral decisions with using the AI?
I have not really encountered ethical issues per se, assuming there's no, data breach and any kind of loss of, patient privacy. The AI companies that I work with are very, very good about anonymizing data, as they send things through the cloud. I personally have not had any experience with any kind of data breach. And in the clinical validation trials I've done have turned out to be very successful. But again, I'm pretty selective of what companies I'm choosing to do, because it's obviously a huge time investment to do clinical validation trials. So I basically was doing it with companies that I really felt would offer tremendous value. And it turns out that they absolutely did. But one thing I wanted to mention is I was very surprised at how little clinical validation data is out there. So we've just published several articles, two major clinical validation trials, and then several other articles, but two major ones in peer-reviewed journals. And there really isn't a lot out there. And I noticed, like when I went to RSNA, which is kind of the biggest meeting in the United States for radiologists, where a lot of new AI tech is introduced each year, there's a huge AI presence there in the AI showroom. I was very interested how much interest there was actually in these clinical validation trial results. People seem to really be taking notice because since there are so many companies, I think one of the biggest problems with AI adoption is people just don't know which product to use and which is actually going to be successful in their practice.
Well, let's dive right into the gorilla in the room. There's a lot of fear around AI and the AI industrial revolution for taking jobs, especially in image analysis. How has that been taken? How has that evolved over the last several years? And what do you think is going to be the end up with that?
Yeah, so I've actually seen a big shift in opinion on this particular topic over the last couple of years. I can really only speak about my specialty, but at first radiologists were very worried that AI may take over their job. I now don't think that that's so much the case. Now it's more of just a practical issue of getting people up to speed and how are we going to implement AI. I think radiologists in general realize that AI is here to stay. And, AI, again, is very good at doing certain things, but humans are much better at doing other things. So again, AI is great with pattern recognition, but we really need the humans for the global reasoning. And when you combine both of them together, I think you end up with really the best result. Now, having said that, one caveat is that I think that although AI won't replace radiologists, number one, I think that in the future, there won't be a single imaging study that isn't first assessed by a computer before a human. And I do believe that that is a good thing. But the second thing is that the caveat is that if radiologists are not willing to learn about the value of AI and other technological advances, they could actually become dated and would be replaced by radiologists who are actually open to embracing some of this technology. That's something that I can see happening in a similar way to, like, for example, the radiologists of previous generations who only knew how to interpret plain films were eventually replaced by radiologists who could not only interpret plain films, but also MRI, CT, and PET CT. It's just at some point you have to keep moving with technology or, eventually the contract will probably not be renewed. And that's really the only way that I could see AI sort of impacting jobs in general.
Yeah, exactly. Bertalan Mesko, the medical futurist, always said that AI is not going to replace radiologists, but radiologists who use AI can replace those that don't. So I think exactly you restated that. How is that going to affect reimbursement? Because again, radiologists are predicated on reading a volume of scans. If there's, 80% of the job is being done by the computer and the radiologist doing the other 20%, and they can read 10 times as many studies, is there going to be a crackdown on reimbursement for those in radiology?
I think that's a big issue, and it's an issue that's still an unknown and will play out in the future. So right now, most imaging facilities are looking for AI products that will add value, but also increase efficiency. And AI tools can do things like separate normal versus abnormal mammograms, or same thing with normal chest x-rays from abnormal. And then that allows the radiologist to really focus on those abnormal cases and spend more time with the critical findings. But again, the radiologist is still a very big part of that picture. So right now, it's not really, in that sense, not impacted. But the big financial question in hand is who pays for the AI technology? That is a huge issue. So my company, RadNet, has actually bought out a lot of different AI companies to sort of avoid that issue, but we also are in contracts with other AI companies that we collaborate with. And those AI tools really do need to add value to compensate for the amount that we have to pay to use those AI tools. And I would say a great example of a win-win would be in image reconstruction. So image reconstruction, this AI tool was originally started by a company called Subtle Medical, but it was such a fantastic product that all the OEMs, GE, Siemens, Hitachi, Philips, all of them have sort of followed suit, and at different levels of fruition with FDA approval for the OEMs. But, we actually use Subtle. We're incorporating that throughout our fleet of MRIs at RadNet. And we also use one of the OEMs right now. We're using GE's deep learning product as well. And the fantastic thing about this particular AI product, and by the way, I predict that this kind of technology will be used at every imaging facility anywhere in the world in the near future. And I'll tell you why, because I just don't see a downside to it. Basically, what you do is you alter your image protocol to scan the patient faster, like 60 to 70% faster. But when you do that, your images become sort of grainy and blurry and more noisy. Then what you do is you apply this deep learning AI technology to that noisy image, and it denoises the image and also enhances the resolution of the image. So what you end up with is the ability to do an exam, 60 to 75% faster, but the image quality is much better than even what you had before, even more than the standard of care. So it turns out that 30% of patients have a severe anxiety reaction every single time they go into a magnet. That's a huge number. And that's not even including all the ones that are taking some kind of sedative, but 30% have a really big problem getting in and having this tight coil over your head for, however long it takes. So if you can get them in and out 60 to 70% faster, that is the number one patient satisfaction. If you poll patients on anything about their imaging experience, they rank being able to get in and out faster as their number one factor in terms of their satisfaction. It's also a win for the imaging facility because theoretically they could scan 50% more patients a day. And it's also a win for the radiologist because if you have higher quality images, metastases start at 1 millimeter in size. So if you increase the resolution and you allow us to be able to catch those mets at an earlier stage, that can really help save lives. Not only that, but it's also mentally much nicer to read high quality images than lower quality images. And so we've looked at the numbers at RadNet, and of course you do pay for these products, but the return on investment is significant in favor of the imaging facility. So you're paying some money, but you're getting a lot of money back in terms of increased efficiency and satisfaction all around.
Yeah, I think it's a fantastic application for AI. One of the things we talked about just before this was, there's a partnership between a human and a computer. One of the things I want to ask you is, do we foresee an autonomous AI in radiology? And the follow-up to that is, when we're talking about ethical concerns about accountability, are we going to have any autonomous AI who's accountable? If something goes wrong, who's held responsible?
Yes, that's a question I see addressed a lot in the literature. And at this point, I don't really think that we are close to that point yet. Until we can teach computers to do a better job with global reasoning, I think that the humans are still going to be important. I mean, you see this not just in medicine, but across all, occupational sectors. AI can make mistakes because AI is coming at it from a different perspective. So I really do think at this point, it's going to be a hand-in-hand process. But in the future, whether there could be full automation, possibly, particularly more for the simple things like the negative chest x-rays, the negative mammograms, And then if there is an error by AI, it really remains in question who is legally liable. That could be a huge problem.
Yeah, I mean, that's been a big discussion even with autonomous vehicles, right? So even in Tesla's hands, if there's a car crash in an autonomous vehicle, who's at fault? The algorithm? Is the person who created the computer vision that had the problem? Is the person who created the car? Is the person in the car? It is, as you know, those who created the GPS, like it's this question of who's accountable. And I've heard from people who are in AI, that's one of the big barriers to autonomous vehicles and other applications of AI is people want to blame somebody if something goes wrong.
That's correct. Yes. And typically in lawsuits, they'll go after the deep pockets, so they'll go where the money is. But yeah, that is going to be definitely a question that will persist in the future. And, I don't know if we may have to get to a point where we have hard legislation about this, but it's really hard to legislate things like this, particularly because AI is a constantly evolving space. And we really don't want it to be stagnant. I mean, in the 15 or so years that I've been using AI tools, the amount of advancement and precision of these AI tools is just incredible. It's not even remotely what it was 15 years ago today. And so I think the FDA is also aware of things like this, because a lot of this is coming down to also FDA approved products, because the FDA really wants to make sure that these products are safe. But this is not a stagnant playing field. I mean, this is evolving technology. So they have to allow room for these companies to get better over time.
Absolutely. And regulation just has a tendency to down innovation. So I'm hoping that that doesn't happen here. How about if I'm a radiologist who knows nothing about AI and I'm interested in this space? What would be your recommendation to that person? What depth of knowledge do you feel they need to have to engage meaningfully with AI and radiology?
Yes, well, I find that people learn best through human interaction and, with people that they trust as sort of experts or leaders in the field. And so, some of the strategies that we use in our company would be to do internal webinars. So if there's a new AI product that we're using, there's often sort of champions in different areas, different subspecialties within companies. And that sort of internal champion, that radiologist, could then put together a webinar and show everyone else in their subspecialty about how they use it. Because again, one of the big things that radiologists fear is anything that's going to cost them more time. So if you can convince them, this is how you use this tool, this is how you would, incorporate this in your report, and you can do this in a very time efficient manner, or actually even save time using it. If they can see that directly through, for example, an educational webinar from someone that they do trust, I think that that is very helpful. And again, other educational efforts that you can do with webinars just through other platforms and live meetings. I think people learn a lot from live meetings as well.
What has been your experience in AI outside of radiology? Have you had any interest or curiosities for how people are using it outside of radiology?
I am actually very interested in that, but it's not my area of expertise. So I try to sort of limit any comments too much to things I actually know a lot
I comment
about.
on stuff, all the time that I probably shouldn't.
But like I said, I do think that every area that has been impacted by tech will be transformed by AI. So it's not just a matter of medicine; it's happening everywhere, and I think it's a very interesting thing to follow.
Where do you think is the hype in AI where it's just not achievable versus where's the rubber hitting the road?
Well, in my subspecialty, I think sort of end user manipulation is very difficult at this point just because we are PACS oriented. We can't really get it into PACS. But a lot of other areas are primarily focused on the potential, not really on. I haven't seen a lot of flat out failures per se, but again, I'm not using products that I think would fail. But, I think really one of the big advantages we're going to see is in things like triage apps that, detect acute findings like brain bleeds on CTs and MRIs and fractures and pulmonary embolism and stroke and things that will help mark, studies stat. Or, for example, VisAIs that detect stroke, will not only find the clot, but also alert the entire stroke team, and those kind of things that will really impact the patient. I mean, VisAI alone, has taken the time from scan time to treatment time, which is, typically thrombectomy, ideally, from 120 minutes down to 7 minutes. And it's had such an impact on patients' lives that CMS is now actually offering an incentive, a new technology add-on payment for any hospitals that actually use this AI technology, because the cost of, for every minute you go without blood flow to the brain, you lose 1.9 million neurons. So time is brain. And if you can apply AI technology that finds that faster and alerts the team faster, there's just really no downside to that. And again, the triage app's extremely helpful. You take the ER radiology resident who is fairly new in their training and, kind of unsure sometimes when they're looking at these emergent studies, and, have some sort of a virtual, AI tool looking over your shoulder saying, okay, this looks like a fracture here, or this looks like a bleed here. I think those kind of things are extremely helpful. So that, and then I think the other big one is really in cancer screening, and that I believe will make a tremendous difference in patients' lives. My company incorporated an AI company called Deep Health not long ago, and it turns out that this AI technology can detect cancer on mammograms up to 1 to 2 years before an expert breast reader. And any way you put in the data, it always beat out the humans. And obviously, the earlier you can detect that cancer, the better chance of survival for that patient. So again, that's a type of AI technology that I see in the future being employed at every imaging center around the world. RadNet actually does 35% of all mammograms in the United States. I mean, that's a big number. And, all of us, all women are, hopefully getting mammograms once a year. So to be able to have that technology that can detect the cancer 1 to 2 years early, I mean, there's just zero downside to using that. And so we also work with another company, Ezra, that helps detect early prostate cancer. And then these companies will then next move into different organs. So they're moving into the lung next to detect lung cancer. So to answer your questions, a long-winded answer, but I see much more and I'm not really necessarily an optimistic person, but I actually see much more optimism than I see failures in AI. And having said that, there will be lots of companies that fail. If their products are not easily integrated into the workflow, or if they come in late to the market and there's already 3 or 4 other companies that are doing the exact same thing, or if they're really not adding a lot of value, they will just drop off by the wayside. And I have seen plenty of examples of that.
Yeah, I was going to ask, you say that you have very strict criteria about who you work with and you've picked a lot of winners. Are you able to share any personal stories about the failures, the ones that you're like, this is just not going to work?
Well, I would say, sometimes I will consult, I serve on medical advisory boards for different companies that I really believe in, but sometimes I'll just do, consultancy work for some other, companies. They see I'm in the space and then they'll ask, hey, can you advise? And there have been several companies where, unfortunately, I have had to say, I don't really see this probably working in the real clinical world at this stage because of these reasons, either because there's a lot of other people ahead of you in the market space, or because you're requiring extra software that you're not going to get radiologists on board to log into, or because I really don't feel that it is going to add value. And so I have had, unfortunately, those kind of conversations before. But even in companies that I really believe in, again, I would not have been able to imagine how much better they have gotten over time. There has been tremendous improvement. And so these companies are very focused in delivering a product that will add value and enhance patients' lives. And so we've gone places that I didn't even remotely expect. And I've also given input as a medical advisor to some companies that I didn't really think it was possible for them to fix the problem. And lo and behold, they come up with a new altered deep learning algorithm and they've just fixed the problem. So it's been very exciting. I mean, I'm passionate about a lot of things in life, but this particular industry, which is, by the way, not necessarily my day job. Again, I work for a company who's very open-minded to it, but there is so much I do outside of my, daily workflow interpreting cases simply because I'm passionate about it and because I believe that there's tremendous value here.
Was there anybody who was a mentor for you along this journey that may or may not have given you some advice that helped you with your decisions? Because obviously, all of us have had to make decisions about companies we're going to work for, things that we're going to do, little tangents within our career. And I'm just wondering if you've had mentors that helped guide you through that journey.
Yes, that's an excellent question. And the answer is absolutely. I think that anyone, as they go through life, as they start to find success and to grow in areas that they're passionate about, is really significantly influenced by mentors. For me, it was the chief technology officer and vice president of my company, RadNet, Dr. Lawrence Tannenbaum. He is a pioneer in this field. He's given hundreds and, probably thousands of lectures around the world. And he's very, very involved in this space. And so I do clinical validation trials with him. And he's been a tremendous mentor for me. And has also really helped educate me on which companies that will probably be successful. And again, help me explore this space and how we can apply this successfully in our practice. And one thing I have realized is, life is about failures, and failures are about a way of growing and learning. And all successful stories end up with hardships along the way. And so I've never really been afraid to learn new things. But everyone does have certain fears. For me, I really wasn't a big fan of public speaking, and he kind of encouraged me to overcome that fear and get out there and share my experience, share what works. And the more I do it, the more I find I'm comfortable with it. And so he's helped me in a lot of ways, not just in the AI respect, but also in learning to not avoid opportunities in life because you may have some fear about it, but rather to embrace opportunities. And it really makes life much more interesting. And it's a wonderful thing to have a mentor like that. And I would encourage anyone that's in this field to also mentor other people if they can, because you can make a tremendous difference in their lives.
And as a physician within this company, are there certain things that you've learned outside of medicine, business wise, and how to do due diligence and things like that? Those are things that were totally foreign to me that I had no idea. What are some of those skills that you've learned that, hey, I was a doctor, I had no idea how to do this or what this even meant?
Yeah, so I guess when you work for a large private company, you do realize that although their primary focus is on patients and quality, it's also, it is, a business after all. And so I think from a physician standpoint, you're always thinking about quality, 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 but there has to be an ROI when it comes to these, it has to have a positive impact on the ROI. Otherwise, it's just not practical to use these kind of tools in the daily practice. So I think I've become more sensitive to the fact that, number one, it can't cost us time. And number two, it can't cost us money. It can't cost us time or money. And as long as the AI product can still deliver on quality and value and not do either of those, then hopefully I'm in line with what the company's goals are as well.
I think practicality and scalability were the big things that I learned, especially coming from an institution where, institutions run a bunch of pilot projects where they're like, oh, this is going to work. Great. Okay. How are we going to scale this? Silence. Yeah. So that's one of the things I've really learned, like trying to understand how to develop products that scale, products that have ROI. I think that's something that's, again, something that's very, very foreign to us as physicians. So let's say I'm a radiologist and wanting to learn more and go into this space. What would be your advice to somebody who's interested in getting involved in something like this? Where do I start? How do I get my skills up to the point where I'm competitive for things like this?
I would say a good place to start is something like the big meetings like RSNA that has the AI showroom. Wander around the showroom, get to learn the different products, and then just see as you're going through what might be practical and applicable in your practice. Because again, every practice setting is different. So we were talking earlier about how important I think triage apps are, but they're not as important in the outpatient setting as they are in the inpatient setting. And so I think for every radiologist, you have to look at your practice and see what is really going to work best in your practice. And meetings are a great way to do that. Also because leaders in the field are talking at these meetings. And so you can sort of hit areas of interest in your subspecialty at those kind of platforms.
That's awesome. So just a few questions. We're going to do a little rapid fire here. What are you reading now?
All right. So number one, I absolutely love reading. And number two, I've been way too busy to read as of late.
Such the truth.
Yeah, I've been busy sort of writing articles and finishing up, different research projects. So unfortunately, I have not had a chance to read a good book lately, but I think you mentioned one that you were reading that I would be very interested in checking out.
Deep Medicine. You have to go read it. Dr. Eric Topol. It's a great, great book. I learned a lot about the ethics and some of the bias in the data from him. And he talks about real practical applications as he talks about the trolley problem and all that stuff that we talked about earlier. It's a very, very interesting read. And I actually listened to the audiobook and I'm just about done.
He's a big leader in this field. I see a lot of his stuff on social media. And, you asked me earlier, a good way to learn. People downplay social media all the time, but actually social media is a great way. It's sort of a short soundbite that can pique your interest in certain areas that you can then explore further. I'm more of a proponent of LinkedIn than I am Twitter, although I do use both. But the reason I like LinkedIn is things can linger longer, whereas Twitter, it's kind of in and out, you miss it and it's gone. But LinkedIn is a great platform to connect with other people that are in the industry and share ideas and find out projects that you can work collaborative on. And that's actually how I know Eric Topol's name is through social.
Yeah, exactly. And then the next question is what are you most excited about? It could be either in AI or outside of AI and technology in medicine and healthcare.
I think I am most excited about the potential for tremendous growth of AI. Again, not just medicine, but all occupational sectors. I think we're going to see tremendous things happen in the future. These AI products are trending to become, sort of broader in their suites and their range of tools. And they either expand through product development or through collaborations with other AI vendors or OEM platform distribution. But I'm really, really interested in the growth. The longer I do this, the more interested I become in this. The more, obviously, the more you know, the more you want to know. That's kind of what has been my experience. I like things that don't have a ceiling. That's always been a draw to me. And AI is one of these areas where there's no ceiling. You can constantly learn. And so, as I said, I predict that computer will see any image before a radiologist in the near future. And I look forward to that because I'm primarily interested in using tools that can actually help save lives, that can improve the accuracy of our diagnosis, improve the quality, and improve the patient experience. And I think we are sort of right. We've just turned the corner in the last couple of years into products that are actually good enough to do that. And that's something that will continue growing. And I mean, I really think these AI applications are going to become, sort of quickly embedded in the fabric of all advanced state-of-the-art imaging. And I'm excited about being witness to that future and hopefully in some small way contributing in any way I can.
Absolutely. Dr. Suzie Bash, thank you so much. This was amazing. I'm sure our listeners will get a lot out of this, and you'll get a lot of heads starting to spin and thinking about artificial intelligence.
Thank you so much for having me.
This is just a plug for you guys to look forward to the next Backtable Innovations, where we meet our physician entrepreneurs and innovators in the field and learn more about what they're doing and what they're interested in. Thank you so much.